A chest X-ray is always taken and is one of the most important diagnostic tools to either confirm or rule out the diagnosis when a physician is suspecting pneumonia. If auscultation with the help of a stethoscope reveals rales or rhonchi and percussion returns a dull thud sound instead of healthy hollow drum-like one, it indicates consolidation or pleural effusion in lungs, which both are indicative of pneumonia. What is consolidation? Consolidation is defined as an area of lung that should normally have air in it and should be collapsible, but is now filled with exudates and has become heavy, firm, and inelastic because of the presence of exudates. Oxygen cannot be absorbed through this area anymore. Now, normal lung on chest X-ray should appear gray as alveoli are filled with air. In a normal chest X-ray, you should always see blood vessels which appear whitish, and the branches also appear whitish as compared to the rest of the lung tissue. Trachea, which is here, is also visible on this X-ray and is black as it contains air. Bronchial branches, however, although they are passing through the lung, but it is very difficult to differentiate between lung tissue and bronchial branches because they both have air and produce similar shadow. So the point to remember here is that blood vessel produces a whitish shadow as compared to trachea and bronchial branches, which produce black shadows and often are very difficult to see in a normal chest X-ray. Trachea would always be visible, main bronchus will be visible as well, but it is difficult to differentiate between bronchial branches and normal lung tissue because they both have same density. It is not a very good X-ray to rule out pleural effusion. As you can see, the costophrenic angles are not visible. If the patient is standing and a patient has pleural effusion, the pleural effusion, because it is heavier than the rest of the lung, it falls towards the gravity, and this is the first place where you should be able to see the pleural effusion. Unfortunately, they are chopped off in this chest X-ray, so it is not a very good X-ray to rule out pleural effusion. Now this image, which is a courtesy of Dr. Chandrasekhar, and his website is also written here, shows complete opacification of right upper lobe. Blood vessels are not visible in this area when bronchi remain aerated. Because the surrounding tissue is white, you can see the branches of bronchus going through the tissue, which is known as air bronchogram. This is right upper lobe pneumonia. Here is another example, middle and lower lobe consolidation, left lower lobe consolidation. You can see trachea. This is normal lung, this is normal lung, and these are the references. Most of the X-rays are taken from Wiki Commons website, and thanks to person or the organization who uploaded the X-rays, and thanks to Dr. Chandrasekhar. Thank you very much.